Good morning, guys. This is Dr. Rob, the Addiction Doctor, along with Jennifer Lovely. This is the Recovery Channel podcast. Good morning, Jen. How are we doing today?
Good morning. I'm doing well. How about you?
San Antonio is cold, but it's sunny. So we're halfway there, I think. We're doing pretty good. Pretty busy this week, though, me and you, yes?
Oh, my gosh. So busy. Yesterday, I left a yoga class, and it turns out that the woman that was teaching my class is from San Antonio, and she is in recovery. So we are going to spend some time together, which I was really excited about.
Beautiful. I love that.
Mm-hmm.
You know, I was stood in the line at Starbucks once when I first came around here. You never know who you meet, and you never know who's beside you. And when I ordered my tea, the lady says, "Oh my God, you've got English accent. Oh my God." So we got chatting. What do you do for a living? And then I gave her my card. And about a day later, her husband called, who could never get sober or clean, who signed up with us for a 12-month deal.
Wow.
Like, wow, you just never know. So, I mean, it's not so that these days when everyone knows what I do for a living, but it's awesome to be here. Got a great show lined up today, Jen.
We do. I'm excited. Can't wait to talk to you.
Sorry, Mark Ryder on the show, guys. Psychologist over in Southlake. I used to live in Grapevine for a bit, so I know Southlake very well. I used to have an office there for about 12 months, but before we moved over to Dallas. So, yeah, it should be a great show. Listen, guys, I want to thank our producer and researcher, Courtney Davis, who's always out there doing the deal, making sure that we get loads of great guests on, because we don't just take anybody, guys, unfortunately. I know a lot of you came on at the beginning asking, can we come on? So we do a little bit of research, make sure that you can give our viewers and our listeners some quality from your experience, strength, and hope, or just something you do today. So if we haven't got to you, we're trying our best. I think we're booked up till March at the moment. But, yeah, we've got some great guests. So,
well, it's really about the quality of the conversation, right?
Yes.
We have the big conversation.
Yeah, definitely. That's what it's all about. So, listen, Dr. Mark Ryder is on the show after this short break. Hey guys, welcome back to the show. My name is Dr. Rob, the Addiction Doctor, along with Jennifer Lovely. This is the Recovery Channel podcast, and we're here live with Dr. Mark Ryder over in just near Dallas. If you don't know where it is, Grapevine, that end, Southlake. Good morning, Dr. Mark. How are you doing?
Very good. Thanks for having me on.
Hello. Good morning, Dr. Mark. I'm excited to have this conversation. So talk to me a little bit about your history and what brought you into psychotherapy.
Well, I started out in music therapy as a profession, and I love the way that music could bring people together and help us connect. And my even origin before that is I grew up with some addiction with my dad, and so that we didn't connect very well. And so I was always longing for connection, and music was just a perfect opportunity, particularly music improvisation. So I took that kind of to the end length with my profession, did a lot of research studies on music improvisation and imagery to affect mood, to affect pain levels, to affect the physiology like white blood cells and other immunology parameters. So really psyched about music improvisation. And then I was taught for about 15 years in music therapy, then studied to get my doctorate in psychology, and I've been a psychologist ever since.
Wow. I see a guitar in the background. I take it you're a musician as well.
Right. Just probably one of two hanging in the corner there. But yeah, I've kept music with me. I took off music for about a year, about 30 years ago, and sort of became depressed, and said, I need to get back into music. And it's been a lifelong urge to keep my fingers in shape and try to find connections through music. So we do a lot of drum circles and other types of music connection still.
That's awesome. I like the music part. We do music therapy here. I'm an old musician from the past. I've got a music room, Jen's seen it. It's got about 12 guitars in, drum set, PA, violin, bass guitars, rhythm guitars, acoustics. It's just I was a pro musician for about I want to say about 5 years or something. Put myself through college. I was a bass player at Abbey Road in London. So I played with Queen, Elton John, all them guys, David Bowie, so it served me well. But I always find that when I get a little bit down, that I can walk into my music room and I have this new amplifier just come out. It's called Spark. And basically you put a progression chords in it, what you want to play, and it backs you with all instruments. There's a guitar, there's drums, there's folk, there's everything behind. It's a limited edition at the moment. It's going to come out next year, hopefully, but it's a beautiful piece of equipment. So I can go and play in there for hours.
Mm-hmm. I'll have to check that out.
So, and I love music too, so I can really appreciate that. I like all types of music, and I know, but probably surprising, but I love rap music as well. I think they're quite fascinating. Good storytelling. So, talk to me about what got you into the addiction portion and how this has affected your practice currently.
Well, when I left music therapy, I went into a private practice with psychology. I was teaching at SMU when I was getting my doctorate. When I finished that, I transferred over to private practice psychology and was there for a number of years, probably 20 years, before I developed this technique called revisioning, which helps amazingly for some of the main causes of addiction, which are PTSD and complicated grief, probably 80% or 90% of all addiction. So just in the last 10 years or so, that's been my focus. And we really can see rapid results in terms of keeping people, who will say that, I just didn't feel like, drinking today, or I didn't feel like drugging today because, now I feel this connection inside and have empathy restored. And so that's kind of a complicated process to talk about, but the procedure is actually pretty easy to do. So.
Let's go back to the trauma thing that you deal with. Somebody comes to you with trauma. What's the first thing you're going to talk to them about? If it's trauma, just around anything, not just addiction, but around anything as a child.
Well, the long story is that we have to assess, what level of addiction, of PTSD they have. So we kind of divide it into high dissociation and low dissociation. So high dissociation would be the presence of extreme difficulty connecting with all the way up to DID, which is the name of the former diagnosis, multiple personality disorder. So we've developed some really neat protocols for high dissociation, and low dissociation is what all the rest of us have who have a little bit of PTSD. And so we kind of assess, and then we have protocols with revisioning where we'll do particular protocols for the different diagnoses.
So can you talk a little bit about complex PTSD? Because I think people get really confused between the two PTSD and what actually defines or distinguishes complex PTSD.
Yeah, so we call complex PTSD, we call developmental trauma. So they're pretty much the same thing, which is kind of differentiated from adult PTSD. So complex PTSD would be things that happen in childhood, abuse, and neglect primarily. And we can find out what the patient needs immediately in terms of if they've got more anxiety, we'll say, okay, well, you need more calming. If you have more depression, then you need more, happiness. And so revisioning is a complex thing to talk about, but we use a mirror, and it's completely based on Ramachandran's work at UCSD, University of California, San Diego. And he is the guy that invented mirror therapy for phantom limb pain. And so I had been working with some patients who had dual diagnosis of depression as well as phantom limb pain, either through amputation, stroke, complex regional pain syndrome, or some of the other pain diagnoses, and found that, the mirror therapy really does work. You can create an illusion by holding a mirror and kind of sideways in front of you. And the illusion is that you see for example, an amputated arm being reattached in the mirror. And everybody, we all know that it's an illusion. It's not the hand being reattached, but the illusion is powerful enough to reverse the neuroplasticity created by the amputation. So kind of a complex brain thing, and we really don't even know all the facets of how that works. But I mean, literally in 2 or 3 sessions of mirror therapy for about 10 minutes, people can get can relieve themselves of the pain they have. So phantom limb pain is kind of a debilitating pain that it's almost as if you kind of imagine that your arm is continually raised and levitated, above the table or the ground for a period of time. And I challenge my clients all the time to do this. Just hold your arm up for a minute and you start developing a lot of pain. And of course, these people have been doing this in the sense that their brain is telling them that their arm is raised up, and that creates you a really debilitating pain. So the mirror, simply by looking at the mirror and saying, wow, it looks like my arm is reattached, that starts to create changes in the brain, which we call neuroplasticity, which we've measured with an EEG. And that gives signals to the brain that the arm is reattached. So I don't need to, I can stand down in the sense of creating this illusion that my hand is raised up in this real uncomfortable position. So very, very quickly, clients get relief from that. So I just took it to the next step, where I thought it just seems so similar that if somebody had complicated grief, we could create in the mirror an illusion that, we just create a prop with a shirt and a headshot of a photograph of the long lost loved one that was deceased that's sitting next to the client. So there's a prop with a shirt and their photo on top of it, and they're sitting next to this in the mirror. They're seeing themselves reattached, simulated reattachment to their long lost loved one.
Nice.
So, and it immediately it created a lot of catharsis, but very different from the kind of emotional distress that people have by just looking at a photograph of a deceased loved one in the mirror. I mean, not in the mirror, but just looking at it straight on. That creates a lot of emotional distress, but looking at it in the mirror and creating that simulated reattachment does the same thing to the brain that the phantom limb case does. And then they recover usually in one day. We rarely have to do more than one session for complicated grief. And what's restored in the brain or in the mind is the lost identity. Because when people say, so how do I diagnose? Okay, well, do you feel like a part of you died when your lost loved one died? Okay, yes. And then what did you lose? Well, happiness, sense of security, physical attraction, if a spouse died, laughter, that voice of reason. These are the parts of the identity that people lose, and they're restored through this, because now I feel like, well, that person is reattached to me. I know it's an illusion, but I feel it in my brain now that they are there, and my identity is restored. The person hasn't come back, but their identity is restored. So that's what we're correcting, is identity. And then if you go ahead.
I've never heard anybody doing this kind of work. And I just picked up on something you said that we're really big on, aren't we, Jenny? This is not a long-term deal. You don't have to be in therapy for 3 or 4 years. If you're not seeing an effect the first day you go, then you need to change your therapist or your psychologist. I know, because I just love, my mind is blown right now, what you just said, with the photograph and the shirt and everything. I mean, this is groundbreaking stuff, surely, Dr. Mark, isn't it?
Well, it is. And
yes.
I have to tell you where I'm going with this, Dr. Mark. Like, can you take a picture of your inner child, or can you put a picture of your inner child there and then recreate that? So
the step to complex trauma then is to, and we learned right off the bat, because we're having to create these protocols out of nothing, we don't ever reconnect in the mirror anything negative. So what we do is we have them imagine a activity that they did, because the activity stimulates the mirror neuron network even more so. And this is what we're targeting in the brain, is the mirror neuron network, which is the brain ability to imitate comes from the mirror neuron network. So we're creatures of imitation. But for complex trauma, we'll say, okay, what's a happy activity you did either to escape the trauma that was happening to you, or maybe for adult trauma, it would be, give me a fun activity you used to do right before the trauma occurred, particularly for like vets, with combat PTSD. And so they look at that in the mirror, and then they usually start to well up a little bit, because they've forgotten how fun this activity was. They may have forgotten about it completely, and they're drawing. They're holding up to the mirror so they can see their face and the drawing, usually right below the chin. So that way you're looking at both together. And that reconnection happens within about 30 seconds to a minute. And then after they go through kind of a brief grief reaction from what they've lost, the happiness, and again, the identity, the pre-trauma happy identity, that gets restored. And then we continue on in subsequent sessions, reconnecting other things like motivation and self-esteem. So we can just simply by having clients draw what they need to have reconnected, and which is only usually in two forms: either I need calming, or I need to reverse the anxiety, or I need happiness to reverse sadness or depression. And that's the primary things. But strengths also get lost quite a bit too. So I had all these strengths I had back in elementary or middle school when before the trauma happened. And I was a good student, and I loved this, and I had a good friend. Then the trauma happened, and then everything just fell apart. So we'll have them draw those strengths in. Okay, you were a really smart person back then. You were a leader, or you were, independent. Because a lot of people who have PTSD are very independent, but they forget about that as being a strength. And so we'll turn any negative situations that maybe involve these into a positive situation. So it's very positive psychology and strength-based revision is.
It's just absolutely amazing. Guys, Dr. Mark Ryder is on the show. This is fascinating stuff. I want to just say before going to commercial break, I thought our company, myself and Jen, are just absolute groundbreakers in addiction. I study neuroplasticity and self-sabotaging neural pathways. I have never heard anything like this before, guys. This is absolutely amazing. Stick around. Wow, Dr. Mark Ryder. Woo, hang on a sec. We're going to be right back with you. Hi guys, welcome back to the show. This is the Addiction, where am I going? The Recovery Channel podcast. That was Life Over Addiction, guys. It was Lance Wright. He's a transformational life coach. If you just listen to this, not watching, he says, let me help you navigate your life's path back to one of purpose and meaning. The chains of shame and guilt no longer have to hold you back. Let's start a new conversation, he says. You can visit the website, lifeoveraddiction.com, or you can call him 310-890-2337. That's Lance Wright. Can't get my words together. And I think why I can't get my words together. I'm shocked. The stuff you've just told, my head is spinning now. I'm back in Dallas in March or something. I would love. I have to meet you. I have to come down and see some of the work you're doing. It's phenomenal. Let me take you back because I know you've got to have experience to do this, and you've got to suffer, trauma in your past. Now, you say your dad was an alcoholic or an addict, and there was addiction in the family, your father. What was that like for you? What was your trauma around that?
Well, we're kind of walking on eggshells, the whole time, embarrassed to bring friends over, self-esteem, because there was obviously some emotional abuse with the raging and so forth when he was drinking. And so all that, combined just really made me want to connect with others. I was always looking for other paternal role models with, my friends' dads and things like that. So it was pretty anxiety riddled when I was growing up. So.
I can absolutely relate to that. Rageaholic was what my growing up was like. So I'm really curious about how you, getting back to this mirror work, I'm really curious about how, when somebody comes in from with an addiction, let's just say heroin, for instance, and they come in, you do the mirror work, you do this trauma work, and then how do you integrate that addiction into that? How do you integrate them to not want to use, or does it just come naturally after the work?
We were surprised to find that it was in a lot of cases, it was just happening naturally. Patients wouldn't even come in for addiction, but they would say, but they may smoke, pot, they may, obviously drink or do other drugs. And it just wouldn't be the focus of therapy. They were talking about, the traumas and PTSD and, a lot of vets that I see for trauma, as well as complex trauma. And so it was just, but then we started seeing that, well, maybe there was an addiction, because they would tell us that, I've been drinking and I just don't even feel the urge to drink now. And because anxiety creates a phenomenon called boredom, and we can even measure it on an EEG with the higher the frequency of the brain waves in the frontal cortex, usually the higher the anxiety. And so people would say, I'm bored. And then we would have them meditate, and then, suddenly the boredom goes away. And I said, well, that's really a cure for anxiety, and anxiety leads to cravings and to boredom. And they're kind of like linked, cravings and boredom. So we started thinking, well, now this is really going to be an interesting technique for addiction. So, which it has turned out to be so. And we've trained people in 2 different hospitals in the country right now who are doing revisioning, and they are both addiction centers. So,
wow, Dr. Rob, we got to get on that.
I know, and this is something you've created, Dr. Mark, correct? Something that you've come up with.
I created the technique not even 6 years ago, well, about 7 years ago, in 2013. And literally wrote the book in less than 2 months, because it was just so powerful. The first 20 clients I worked with, it was just so powerful that the next day they call and say, I'm not having any grief anymore over my grandson who committed suicide, my husband who died of a long prolonged illness. And I mean, all these cases, we would see just immediate recovery from that.
I just love that. We interview so many people, and I've been in the industry for about 27 years, and I'm always looking for the next groundbreaking technique that we can discover, because I truly believe, and I'm going to get some flack for this, alcoholism can be cured. Trauma can be cured if we're taking the brain in the right direction. I'm a great believer in what we see is how we feel. So are you always looking for? Are you still searching? I mean, this can't be it. I mean, this therapy that you come up with is amazing. It's instant, which I love. We always say that we're instant from day one. Something should change. Are you still researching? Are you still going to go on to something else?
Yes. Well, we're doing research studies. We just are getting ready to publish one that was done at Sierra Tucson Treatment Center, where a lot of their therapists are doing revisioning now, and showed that 62 out of what we treated 62 patients in the study. We taught their therapist, and they did this work really, and found that about 94% responded positively with happiness and calming. In other words, these patients came in with a lot of anxiety and depression, and within one session, and some of them only got one session of revisioning, some got up to 2 or 3 sessions, but their ego strength, their ego repair and their dissociation came down dramatically. So they weren't, and actually addiction is a form of dissociation. So when we dissociate, it's kind of like we check out, and men do it during football games. The stereotype is, and women do it when they're shopping. However, when it's dysfunctional, we're not making connections, because my mind is somewhere else, because maybe somebody in my family is triggering my abuse or triggering the trauma with yelling, screaming, or something else that's going on. So this reconnects the connection, really, and it reconnects the mirror neuron network of the brain and activates that. So the mirror neuron network in the brain is responsible for empathy. And so with revisioning, that's what we're actually increasing is empathy. And now we can say, we've got a technique that can increase empathy. All the time I get somebody who comes to my office and says, my husband has no empathy. Can you treat that? Yes, we can. So before we couldn't have, but it's kind of amazing. The other interesting thing with addiction is that we found that somebody comes in high, from drinking or even opiates or whatever, that revisioning doesn't work, because alcohol and drugs turn off the mirror neuron network. So what I was saying is that drugs turn off empathy. Mm-hmm. And that's why you can't really have, I tell my couples, I said, don't try to talk about your feelings when you've been drinking, because, you have no empathy anyway. So just, sober up the next day if you want to discuss this issue and talk about your feelings. That's the time you want to do it. But anyway, go ahead.
No, I'm sorry, Dr. Mark. I'm sorry. Go ahead.
Well, so this is why we, tell couples that, or anybody that really, what's happening in your brain is you're recreating empathy. When you create empathy for your childhood self that was traumatized, like in the case of complex trauma, then that childhood self, like literally within 24 hours, grows up in a much more mature way. And if you're treating the past, you're changing the future. And so these people right in front of your eyes can, I know it's kind of a wild concept, but you can change your past and, and heal the trauma and therefore change the present and not have to have those symptoms. So it's fascinating how fast you can change the brain and see how that changes the present. Then they start to have positive memories float up from the past where they only had negative memories before. Wow, I'd forgotten all about that trip we took, and actually Dad was really nice on that trip. He wasn't an ogre or something. So it's really been fascinating. We're just touching the surface and trying to get other institutions who do better research, who have the availability to do all the good research, control studies to do this. And we're doing research with University of California, San Diego to look at what's happening in the brain when we're doing revisioning. And also Inner Health is in Dallas has some trained therapists that are doing revisioning as well.
So what I love about this is that it's not bypassing. It's not bypassing the pain or the trauma because you're seeing it. You're experiencing the grief and then the part where you talked about going back to the child and then having good memories come up. And it's almost like its own form of like what is it? The psilocybin, the mushrooms that they do. You know what I'm talking about, the therapeutic mushrooms. Help me out, guys. What's the name of it?
Well, for addiction, psilocybin and mescaline and some of those.
Thank you. So I was forgetting. So it's that because what happens is that you're able to work through that process and then good memories come up, right? And so it's kind of like its own form. But I want to kind of dive into a space right now. We have a lot of trauma in our country, and coronavirus is creating an immense amount of trauma because of the disconnect that we have. How can this play a role in a country that's full of trauma with the coronavirus and being disconnected?
Right. Very much. Immediately when we went into lockdown in March, I posted some revisioning exercises that people could do, just any people could do, to help them with their self-esteem, maybe with loss if they'd already had some loss, loss of a job as well as loss of an individual. Just loss of not being able to see their kids or grandkids, and et cetera.
Right.
So I posted these on my website, and then I started getting a lot of feedback that these are really helping. But then I found over the 10 months or so we've been in in quarantine more or less, that what's happening, what I'm hearing a lot of from clients is they have a fancy term called psychomotor retardation, which is what we really call just motor fatigue. And motor fatigue is actually a symptom of depression. However, I'm seeing a lot of people who have the motor fatigue, but they don't have depression. And so, again, motor fatigue comes from the mirror neuron network, because when we imitate people, and we do this every day with everything. I mean, you can be, you cross your leg when the patient crosses their leg, you yawn when they yawn. I mean, this is all mirror neuron activity. And, but just talking and reaffirming and confirming, what people are talking about and so forth, that's all imitation. And that activates the mirror neuron system. But what is the chemical for the mirror neuron network? Any guesses? Oxytocin.
Oh, yeah.
And so oxytocin, in addition to being the cuddling hormone, or really it's the trust hormone, is also the imitation chemical in the brain. And so that's what people are experiencing a loss of, because we're sitting in front of mostly, a lot of screens or TVs and things like that. And we're not getting all that imitation that we used to get by hanging out with people live and doing all the things that we used to do, walking, talking, and all those things with them. I mean, I haven't been able to participate in a music ensemble or a drum circle for 10 months. So, and And so motor fatigue is just like, well, I just don't want to pay the bills today. I'm not going to call those people back. I'm not going to send those emails. So it's just kind of falling behind. I've seen a ton of kids, like adolescents, who their grades plummeted when they went into virtual. And so, I'm not going to enter the debate about whether we probably needed the virtual because of the pandemic. But on the other hand, it is creating this out of balance aspect of us where we're not being around others and imitating. So a lot of kids' grades are kind of going down, and the ones who are going live, or that I saw in live school this last semester, actually were doing better. So
I love it.
So that's one way that pandemic is causing this psychomotor retardation without really causing depression. So it's kind of interesting how they tease those apart. So we can do revisioning exercises to, I've got a bunch of those posted on my website, drmarkryder.com, that show you how to do imitation activities and how to, do things with people and very simple things you can do around the house that'll make up for that lack of imitating that we're not getting through the kind of the quasi lockdown that we're in.
Hey guys, thank you for watching the Recovery Channel podcast. Stick around. We'll be right back after this with Mark Ryder, Dr. Mark Ryder. Fascinating stuff, guys. Hey guys, welcome back. That was Live and Recovery Interventions. Recovery begins today. Recovery begins together. Give the gift of recovery, says Travis. Travis is a really good friend of ours. He's an interventionist. If a loved one is suffering or in trouble or you need an intervention, call Travis on 801-573-4188 or visit the website and see what he's all about, livingandrecoveryinterventions.com. And remember, recovery begins today. Recovery begins together. So, Dr. Mark, talk to me about the isolation that we're suffering now. What sort of effect is that going to have on us in the coming months or years?
Well, fortunately, it's a temporary effect because once we get back into, being together and imitating each other, which is that critical mirror neuron function, then we'll start building our brains back up with oxytocin, and we can recover from this. Even though there are better exercises to do at home to do this rather than just, sitting in front of a TV. So, so it's definitely recoverable.
Well, that's so good to know, because for so many people, it feels like we've got 81,000 people have died from the epidemic of addiction in the midst of our pandemic. So there's a lot going on, and people are not functioning very well. And so, do we just send everybody to Dr. Mark and we hope that they get better? It's really scary. And then, I'm also kind of curious, you talked about the empathy piece. Is this a way to help narcissists, malignant narcissists or narcissists? I'm curious.
Well, it's an approach in that direction. And usually with, like malignant narcissism, there's going to be a lot of detachment. So, it's an attachment disorder where there was very poor attachment, growing up, and particularly in the first 2 years of life. So we can restore that anyway with revisioning, in that piece. My colleague, Lynn Heselton, treats a lot of personality disorders and even eating disorders as well, and things that disorders that have a critical mirror neuron piece missing in the brain.
I love that mirror neuron piece. If you stood at home or listening, guys, I know a lot of you are, and you're thinking, what the hell is that? It's true what they say. A man used to say it. Be careful who the kids you hang around. Oh, he's hanging around the bad kids at school. You will become a bad kid. I once got told ages ago, if you're earning 30,000 a year and you want to earn 50, hang around with the guys that earn 50, because that's what it is. It's an old sales technique as well that people used to use. Show me your friends and I'll show you your future is one of my favorite sayings, because you become that person. You know, like Dr. Matt was saying, cross the legs, you cross the legs, especially in a sales deal. He has a martini, you have a martini. If he has sausages, you have sausages. And you get that connection straight away as if you've known each other for ages. So it's really important, you know, with our surroundings is who we surround ourselves with and what we listen to. My self-dialogue can kill me, you know, and what I listen to half the time is what I repeat to myself when there's nobody there. Think about that for a second, guys. You know, it's really important that we start talking to ourselves positive and we start looking at new evidence-based therapy that's actually working. Dr. Mark, what does the future hold for you?
Well, we're hopefully we'll get out of lockdown and then we'll be able to continue our research and teaching. We've kind of put our teaching on hold, the large teaching groups. I'm still teaching individually on virtually, but we got a lot of people signed up and ready to continue with the larger teaching groups. We really want to move into the university settings and do some more research to find out what is exactly happening in the brain to kind of prove, you know, the mirror neuron network. We know it's activating. I do EEG as well. And so I've actually, used to hook clients up to EEG while we were doing this work and just to kind of monitor, was the mirror neuron network being activated? Well, it was. And so that was, you know, we want to branch off into that. So, we really want to create a center. I've moved in the last few months to a new location where we have a large conference room where we're going to start having conferences on revisioning, both research and clinical training conferences. So that's some of the things.
Well, so I'm really curious because music has such an impact on memory and such an impact on emotions. So how does music connect with this revisioning?
Well, music is a mirror. And so one of the techniques I developed in music therapy years ago in about 84 was that if we played music which matched someone's pain level, so it's going to be a little cacophonous for about, 30 seconds or so, but then change that music, and I'd be the conductor, telling people to calm it down, slow it down, and kind of come up with a melodic tune in that music that represented their pain relief or the body's endorphin system to block the pain. These patients would, sure enough, have a significant pain reduction. Their muscle tension would come down. Their immune system would be boosted. So we call that entrainment music because entrainment means to get on board like a train and pull you along. So you have to start with the level. So if you imagine a simple example is if you're trying to catch a train and the train's pulling off from the station, you want to get on that. You have to run a little bit to get on that train. You can't just be waiting for the first door to come along and then jump. It's going to take you for a jolt. So that's kind of what we had to do. We had to match the music to people to then kind of get their attention and then pull that along. So these people are in pain, or maybe they already had catastrophic illness like cancer. And so we'd start with an empty immune system. So imagine your cancer. Okay, now imagine what your body's immune system is doing to attack the cancer. So we'd create music for that. So it would start off pretty without much sound, and it would build and build to something kind of glorious that would, you could see the client would be laying down just enjoying this music. There'd be maybe 5 or 8 of us musicians playing, and boy, their smiles would come on their face. You knew they were having a great experience, and they said, "Well, I could really see my immune system in my brain now." It's this long octopus, purple octopus, and it's going in there and it's pulling out all those cancer cells and just getting rid of them. Well, those clients would have better management of their chronic illness than the people who weren't doing any imagery like that. So that was, but also then in just the last year, I did a study, a private study in my office, really, because I always thought that, listening to music, we knew that probably performing music was with others is going to be a mirror neuron activation technique. But we found that just people listening to music had a mirror neuron activation in their brain. And so we suspect that, you're connecting with either the composer. So if you're listening to rap, you're probably identifying with one of the rap artists or one of the composers of the music that you're listening to. And that identification process is imitation, and that's already mirror neuron network. Mm-hmm. So ideally, you want to choose a friend of mine asked me last week and said, So what is it like? What does it do in the brain when you actually find a mentor? It could be someone you're not working with, but just like it could be Jesus Christ, or it could be, some mentor of somebody that's out there, Sanjay Gupta or anybody else that, that a writer, Brene Brown or something like that. And when you are reading her book, are you identifying with her and can almost like see her sitting in her chair, see her understand what she's feeling, what she's been through? That's all mirror neuron network, because that's empathy. You're empathizing with simply the journey they've taken to, write this book, this music, or whatever it is. So simply listening to music, as well as playing in music improvisation groups like a drum circle, that all involves empathy. And because you got to hear somebody else, you got to see what they're doing. If they're doing a new pattern on the drum, you got to follow that. So
that's where really good therapy comes in, and that's where the healing of therapy is. That relationship, that mirror neuron therapy. That's like, I think that's one of the keys, right? And really good, healthy therapy. I don't know. That's my.
I love the way. If you guys that go to church and you're wondering why they always have music at the beginning, the praise band or the worship band is kind of that same level. They're getting your brain ready, the central nervous system, to listen to the message. That's what it's all about. They're not stuck there to be musicians and rock out on their own. There's a purpose for that. It goes back generations and generations. And I'm so glad that we're looking back in the past to come up with new therapy for the future, because it all lies. It's like the gut feeling. We forgot what the gut feeling is. The gut feeling is real. It goes back to the tribal days. Somebody would get a gut feeling, wake the rest of the tribe up because there was danger near. And we forgot all them things that we were God given. So I've got one more last question for you, Dr. Mark, because I really want to know this. What's your proudest moment of your life so far?
Oh, that's a hard one. Well, probably developing this technique, in the last 5 or 6, 7 years, because it's helping so many people so much faster than we could before. I mean, I was struggling, and my fellow therapists were struggling for the last 20 or 30 years, to find techniques that would treat this, that, and the other. And it's been interesting to be in a psychologist for this last 30 years to kind of see the progress we've made. EMDR was not even available when I started out in doing counseling in about 1990. And, so we're adding a lot of arsenal to our treatment techniques that we can, do. So I can, if the patient's got trauma and they've got memories of that trauma, I can do EMDR. If they don't have memories of childhood because of trauma, I can do revisioning to correct that and connect them with what they need to be connected with. So it's not a matter of sitting around doing passive therapy, just listening and wondering what's going to happen. Even though that's not bad therapy, it just is a slower process. But now we can really rapidly reconnect them to strengths that they are missing, and it changes their lives. I mean, in an instant and in the very present.
I'm moved beyond. I got goosebumps, and I'm like ready to fly to Dallas, Dr. Rob, and go hang out with Dr. Mark. So talk to me about what you want people to know. What do you want to, leave people with, our audience? What do you want people to know?
Well, first, that there's just a part of the brain that can be activated so quickly. I mean, we're kind of learning differently now, but we were taught back at 30, 40 years ago that the brain was not very plastic or changeable, that, if you had a stroke, that, you could give it 6 or 12 months, and that was about as much as you could expect of improvement to get. Now we know that that there's malleability, and that your neurons are very changeable in your brain, probably up to a very late age. And so that's really positive. Knowing that there's techniques that can quickly get to the source of things is really, clients like that a lot. They also, as some of the more difficult or regressed clients that have more dissociation, they don't like to relive their traumas. Mm-hmm. And so EMDR, as effective as it is, they don't want to necessarily relive their trauma. So with revisioning, they don't have to relive the trauma. We're simply reconnecting them with a fun activity they used to do either during or before the trauma happened. So it's really very positive way to approach therapy.
Wow. New science, new brain science moving forward. I sometimes wonder why most therapists are still teaching from 50s and 60s textbooks when all this new stuff is available. The instant the instant change in the brain neural pathways. The instant change. That's what it's about, the instant change. Guys, Dr. Mark Ryder was on the show. The website is at the bottom there. You need to go visit that website. Fascinating guy, fascinating person. I just want to say a couple of things, Dr. Mark, before you go. First of all, thank you for doing all this research with this new science that we have and tested and tried going forward. And thank you for all the millions, because don't forget the ripple effect of people that you've affected over the years. And thank you for being on today. Thank you for being honest, and just thank you for who you are. Great guy. Thank you so much.
I love being here, and thank you very much.
Yeah, thank you so much for your research, for your brain, for looking into deeper modalities of how we can heal the human condition. Really is what this is about, is healing this, basic human condition of trauma that we all experience. So you are an inspiration to me. Thank you so much. And it was lovely meeting you, and I hope to meet you in person someday.
The invitation stands. I'd love to, I'm always doing a little bit of revisioning for therapists just to kind of show them what it's like, and so, sure, come by, and I'd love to show you a little bit about, what it's like.
Thank you.
Hey guys, we'll be right back after this. Come back, guys. For Cover Channel Podcast. My name is Dr. Rob, along with Jennifer.
So I'm curious.
I
know. I'm just curious. So does this mean like I'm mirroring you? I get to be you?
Definitely. Definitely. As long as I can be Dr. Mark. Okay with that.
Right?
I've never heard anything like that in my life. It's like somebody coming up to you when you're at school with a big ice cream. It's like, oh my God, that's what I needed to listen to. Because how many times, Jen, are we telling people, going to therapy 5, 6, 7 years, and I'm like, if you don't get an effect from day one, change your therapist. Yeah. Goodness me, this is instant. Trauma's instant, recovery's instant, getting back on track is instant. I don't know what to say. I'm speechless.
I know, it was amazing. So this is definitely somebody that we need to seek out and spend some time with, because that is it's blowing my mind.
I can vision a trip to Grapevine and Southlake coming in my mind now. As long as it's first class, Jen, I'm on board.
I know, right? Anyways, that was awesome. That was really, really cool.
I want to stick my neck out here and say that that's probably one of the best, if not the best, people we've had on regarding the brain moving forward, trauma and recovery with facts and science backing it. And that is the most fascinating person. You know me, Jen, I'm never stuck for words, but I was kind of stuck for words then, because everything was running through my mind. It's like, oh my God, the photograph and the shirt. And it's like, yes. Well, first of all, I was pissed because I didn't think of myself, of course. Secondly, I'm just so excited about that. There has to be a trip to Southlake. Yeah,
that does. So really good. Good.
To book the tickets straight after this, and we'll go down.
Okay. Let's do it.
Mark out for lunch and Piggy's brains.
Love it.
Guys, listen, if you want a free book or a couple of books, guys, don't forget we've got The Addiction Diaries by Jennifer, and we've got Daddy, Please Stop Drinking, the last words my daughter said to me. Both books are available. If you want a copy and in the USA, just send us a quick message. We'll sign one or two, whatever you want, and we'll send it off to you. Always here, giving back as much as we can. But for now, guys, I want to say thank you. Once again, thank you, Dr. Mark Ryder, and markryder.com. drmarkryder.com is the website. Thank you for coming on. Thank you to our producer and researcher, Courtney Davis. Hello to Ellie in England. Ellie Lawton, she was listening to us, our friend. And guys, we'll see you next week. So for me, I'll say bye-bye.
And I will say bye-bye. Have an amazing weekend.